Rectus femoris.
Yes.
Vastus medialis. Vastus lateralis. Vastus intermedius.
Okay. Now, where are the muscle origins from? Any idea?
Ilium.
Ilium.
Not ilium. Yes.
لا acetabulum
Acetabulum لا. Acetabulum not.
Muhammad. Okay. Now, what is the action of quadriceps?
Extension of foramen
That's all.
and
Flexion of
Yeah.
and
extension of the
flexion of hip.
Yeah. Extension knee, major action. Main action is extension knee. Small action is
flexion up.
flexion hip.
Yes.
Now, if there is a flexion hip, what should be the origin?
Iliac bone.
Iliac bone. So, which muscle goes up?
Which muscle go up?
rectus
And quadriceps and vastus lateralis, vastus medialis, vastus intermedius.
Rectus femoris.
oh the rectus femoris.
Amaris. All sleeping, yeah? No, you came from Riyadh.
Rectus femoris. It will go up.
You have heard of ASIS?
Yeah.
What is the full form of ASIS?
Anterior superior iliac spine.
If there is something called as anterior superior iliac spine, then
Yes, posterior.
if there is posterior superior iliac spine,
Laterals.
then what should be? Anterior posterior word. Then take the next word.
What's posterior?
PSIS.
Yes, yeah.
Sorry.
Abdulaziz, you have been with him more? That is jumping on you also? From him?
Infection. Infection.
Huh?
Infection.
Refraction?
Infection.
Infection. From his head it's coming to your head also? SIS, anterior superior iliac spine. Anterior superior iliac spine. Anterior superior iliac spine. Posterior superior iliac spine. Anterior posterior word. Next word is what?
Anterior and lateral.
So? So?
Posterior inferior iliac spine.
Then anterior.
Inferior iliac spine.
The origin of rectus femoris comes from anterior inferior iliac spine. Have you heard of it?
And that's down little?
It should be down only, no?
Yeah, a little. No, I meant yes, it's like a pointy thing. You can feel it. No, this, you can't feel it.
You cannot palpate it,
Palpate.
but it's anterior only. That's why it's called as anti-inferior iliac spine. Now, as soon as the ASIS is there, you cannot palpate it. You cannot palpate it, okay? But I can say around 1.5 inch to 2 inch down, there is a point called as anterior inferior iliac spine. I will show you it on the catalog. I will show you it on the model. Now, from there, the rectus femoris origins comes down like this. From the anterior part of the thigh, all the three muscles, the quadriceps, medialis, intermedius, and lateralis, all three come together. With rectus femoris coming from anterior inferior iliac spine, makes it a tendon here, and crosses the patella to causes. What is this? This is patella. What is down this?
Tibia. Tibia.
No, muscle.
Muscle.
Can I take your pant up? Relax. Now this is patella. What is this? Someone take your leg up. Extension. Hold this. Try to hold this.
tibial anterior.
What is this?
tibialis anterior تحت شوي. ما tibialis anterior.
What tell you?
End of the muscle.
End of the muscle. Everything has to end.
Yeah.
What is it? That's why I'm calling you specifically this name. Because it has got a name. Eyes. Where's your anatomy gone? I know it's volatile. I told you it's like a petrol. It will go. But it doesn't mean that it should go so fast.
You mean the insertion.
What is this? What is this? Scholar! Why day by day you're going backward, huh? You know, there is a proverb in my language. The royal horse. You know the royal horse? Royal means king.
Yeah.
King has a horse?
Yeah.
Horse.
Horse.
Yes.
Yeah.
الأصيل.
King horse is called as royal horse.
ملكي.
Royal people, Malik, horse. Royal horse,
No, no.
this is ligamentum patellae. Have you heard about it? Patellar ligament, ligamentum patellae.
Yes, but the ligament.
تكتب
Just man.
المكان.
Wherever,
Yeah,
guys,
yeah,
without this ligament, your knee is, you cannot stand. Without this ligament, you cannot stand. You cannot do anything. This is the strongest ligament in our body.
Over patella.
Over patella.
Okay.
Patellar ligament, ligamentum patellae, any name you call it.
Okay.
Heard it?
Yes, the patella ligament. You have to forget.
Shift delete.
Huh?
Shift delete.
Guys, please don't shift delete, guys. You do shift delete for anything. Please, education is not a shift delete. It's like a wealth. Wealth, money, money, money. Okay, guys. Now, it crosses over here. That's the reason it's a two joint muscle. Two joint muscle is, it crosses two joint. It crosses the hip joint, it crosses the knee joint. Action in one joint can cause relaxation in other joint. Always, this is probably Radha might be telling you. This is what happens is, if a muscle is two joint, one should be relaxed, the other should be stretched. Or other should be relaxed, one should work. Now that's the reason what happens is, this rectus femoris, this muscle, okay, helps in stabilizing the pelvic, when knee is done with extension. Understand?
Yes.
It fixes the pelvic when knee is doing extension. So now, if I have to stretch, what I have to do? I have to stretch what?
Quadriceps.
Rectus
Rectus femoris also, right? So what is the best position?
from.
Prone. Okay, come back prone. When I go prone, first thing always is, what he showed is quadriceps, but his technique was not wrong. Can anyone show me once again?
Quadriceps.
Yeah.
Stabilize this.
Show. Don't talk. Everything use your hand. Okay, wait. Slow. No jerk. Stretching, I told you, never jerk, guys. It will finish there. First thing, what I will do.
Flex. Knee.
Flexion.
This is normal range. This is normal range. I'm not pushing it. This is what he can take. Now, the best thing is, first complete the normal passive range. Complete the normal.
Passive range.
Normal complete passive range is heel touching the gluteus maximus.
It's not.
Normal passive range. Now, if a person is very duba, his thighs are very good, you try to push, this heel will never touch this. So whatever you do, you might do it maximum, how much ever you get. Okay, but you should take it maximum. At this point, what happens is, always try to touch this to gluteus maximus. Now, I touch this. Okay, when I touch this, the pelvic will start moving. This side pelvic will go up. Why this side pelvic will go up?
Because rectus will pull it.
Will pull it where?
Down.
Up.
Back. Which is back here. This is back.
Back.
Down.
Use the proper word. What is back?
Extension.
Back is back.
Extension. If you press it, the quadriceps قلبه.
Guys, there are only 4 directions in the world.
Down. Posterior.
Posterior is this, right?
That's it.
The movement of the muscle is inferior. How will the pelvic go? Sir, don't sleep. Answer.
It will pull it.
I'm expecting answers from you, guys. If your batch is like this, then what about our batch, guy? Your anatomy has become so hopeless. So what will I expect for other people?
It will pull it.
Where pulling?
Bullet inferior.
Inferior, can bone, any bone can move inferior? Can this pelvic move inferior?
It will tilt. Interior.
Tell that.
Okay.
The muscle is anterior, it's pulling. So where, what will happen? What is the movement
Interior.
in pelvic?
Tilt.
Only tilting, right?
Yes.
Pelvic has got only tilting. So it will tilt anterior. So if it tilts anterior, what happens?
It will get the patient back.
Get the extension.
Push the patient.
Extension.
The
No. How? How? You understand the question or you don't understand the question? No, man. Did you understand the question? Vishay.
A bit stacked. The rectus femoris. You elevated.
There's an anterior tilting of the pelvis, guys. There's an anterior tilting of the pelvic.
Yeah.
Now, as soon as the pelvic tilts anteriorly, what happens? What happens to the muscle?
Which
Try
muscle?
to
Which muscle?
try to do
Quadriceps.
Try to do extension by itself. So it
relax muscle.
So stretch.
knee.
Relax
Correct.
quadriceps.
Strength hip extension.
No. First point was better.
Relax rectus femoris.
It relaxes rectus femoris. As soon as it moves anterior, what will happen to rectus femoris?
Relax.
It's shortened, right?
Rectus femoris will relax. If I relax rectus femoris, is my stretching right or wrong?
You should stretch.
If the rectus femoris gets relaxed, then the stretching what I am doing is right or wrong?
Wrong.
Wrong?
Yeah, because I need to stretch the quadriceps and the rectus femoris included.
Understand? To stretch, I need to fix both the ends and then pull the muscle, right? So that's the reason what I am doing is I am stabilizing the pelvic. As soon as I push the pelvic down and hold this, the pelvic will not come up. Now, you do it, do on that leg. Do whatever you know, what you were doing. Okay. In this, what is happening is the pelvic, where he is stabilizing, where his hand is,
Yes, yes.
Dorsal lumbar.
his hand is in lumbar. His hand is in lumbar. So what will happen to the pelvic? The pelvic can tilt because his hand is in lumbar. His hand should be at the pelvic. Yeah, PSIS or ischial crust. This is ischial crust. This is ischial crust, right? So I stabilize this. Now pull. Yeah. Now what will happen? Is this right?
Yes. Now the muscle gets.
Wait.
This one.
Yeah. Now what has happened is he's pull. Wait. Take it out. Slowly. Don't give jerk. Take it out. Now, is this like this coming up? What is happening? The leg has come up. So is my stretching again okay? No, because it's getting relaxed. You understand my point, guys? So the next thing, the best thing is take the hand with the hand like this. Take the hand like this. Fix it with one hand. Fix it like this. Fix the pelvic like this. It will not hurt him because I'm not putting my elbow into it. I'm pushing the.
Yes, yes.
Now I take this hand out. I push this hand out and I ask him. Sir, how was it? Which was more stretching? No, that side was more stretch. Right was more stretching or left is more stretching?
No, that's right.
Left side.
Left. This is left. Why? Because see, I've kept this one. I've not left any chance for his body. That's why I'm using my whole body.
You stabilize it.
Especially more comfortable because
Patient comfortable later.
After stretch.
After stretch only he will become.
أنا